One of the skills you may be asked to perform when you take your state exam is to provide client with passive range of motion exercises to one hip, knee, and ankle. The client needs his or her hip and knee flexed and extended, and the dorsiflexion and plantar flexion to the ankle. For testing purposes, the client needs 3 repetitions of both exercises. The instructions provided at the test site will indicate whether the exercise is to the left or right side. The role of the resident client is played by a person. The checkpoints the state evaluator will use to evaluate your performance are listed at the end of this video demonstration. Greet the client, address them by name, and introduce yourself. Explain the procedure by speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible, and ask client about personal preferences. Provide privacy with a curtain, screen, or door. Instruct client to inform you if pain is experienced during exercise. Support the client's leg at knee and ankle to protect the working joint while performing range of motion for the hip and knee. Move client's hip and knee 3 times through range of motion, flexing knee and hip, raising towards torso and returning back to mattress, flexion, extension, while supporting the limb, moving joints gently, slowly, and smoothly, discontinuing exercise if client verbalizes pain. Support the client's foot and ankle close to the bed to prevent heel friction against the mattress while performing range of motion for ankle. Push or pull the foot up towards head, dorsiflexion, and push or pull foot down towards mattress, plantar flexion, at least 3 times while supporting the limb, moving joints gently, slowly, and smoothly, discontinuing exercise if client verbalizes pain. Make sure the signaling device is within reach and bed is in low position. Wash your hands before performing your next skill or at the end of your last skill. Skill checkpoints. Does the candidate greet resident, address by name, and introduce self? Provide explanations to resident about care before beginning and during care. Exercise correct joints and correct side when performing range of motion. Support extremity to protect the working joint throughout range of motion exercises. Move resident's hip and knee through range of motion, flexing knee and hip, raising towards torso and returning back to mattress, flexion extension. Support extremity to prevent heel friction against mattress during range of motion exercises. Move resident's foot up towards head and point down towards mattress through range of motion, dorsiflexion, plantar flexion. Ask resident to report discomfort during range of motion or ask if resident has discomfort during range of motion exercises. Control extremity throughout range of motion exercises, providing smooth, slow, non-forceful movement. Ask resident about preferences during care. Use standard precautions and infection control measures when providing care. Ask resident about comfort or needs during care or before care completed. Promote residents' rights during care. Promote resident safety during care.